Hello, I'm Dr. Miguel Cruz at Cruz Life Center in Burnsville, and we're here to talk a little bit about laser today. And I've got with me Mr. Bruce Valin, who's been having some laser treatment, and I'd like for him to tell us a little bit about your story, Bruce.
Well, I've been involved with chiropractics for about 25-30 years, and started over in Boone and got a good recommendation from you from over there, and we finally moved over to Burnsville. I looked you up, and unfortunately, it took me a while to find you, but once I did and started treatments, I was very happy about it. And I've had a lot of problems, but the first time I came in I had a knee problem, and that's the first introduction to the laser that I've had. And it worked so well on my knee, and my knee felt better. I could get around a lot better without pain. And then finally when my back went out and I had serious pains in my back, I said, well, I'm not going to do surgery. I want to find an alternative way, to handle my pain.
Mm-hmm.
And I know what laser did for my knee, and I came in and you said, let's get started on the laser on my back.
Okay. I've got an MRI that Bruce had here, and just to read off of what the MRI was saying, you had between L2, 3, 4, and 5 and S1, these are all the lower vertebrae in his spine. He had spinal stenosis with deterioration as well as bulging discs. So overall, what kind of shape were you when you first walked in here with that back, Bruce?
I couldn't walk without excruciating pain.
You were on a walker, if I recall.
Well, I actually almost crawled in. I had to hobble in. I didn't have a walker yet. Didn't really know what was wrong with me.
You started having to use the walker then.
Yeah,
Okay.
in order to even get around comfortably, I had to have a walker. So.
And then how's everything resolved here for you?
It's done real well since we found out what the real problem was. We had done laser before the MRI, and it was helping, but it kind of went stagnant. And then once the MRI came out, we knew we were in the wrong area. We needed to add a couple more areas, and once you started on that, the pain just disappeared and has gotten better ever since.
Which is a very good point. So what happened there was with the laser and the MRI, we knew exactly where to concentrate the light therapy for our best results. Before we had the MRI, we were basically shooting in the dark. One of the things I often tell my patients is where the pain is not always where the problem is, and that was the situation with Bruce. And then once we got right to the heart of the matter, things started resolving very quickly, didn't they?
Yes, once we hit the right area.
Super. Tell me about the knee, though. What had you done prior to seeing us with the knee? Because I remember you did get very good results with the knee as well.
Really nothing. It just when I was hiking or walking, the pain kept getting worse and worse and worse, and it started swelling really bad.
So it was interfering with your ability to hike and walk?
Right.
Be able to do that with your knee now?
And, I studied it and looked at it and said, well, if you can't walk or hike, if your knee's hurting, do swimming or bike riding. And started getting into the bike riding, but by then I knew I needed to see you because I believe in chiropractics, and didn't know about the laser until I came in here, so that was a godsend.
The laser definitely turned you around, didn't it?
Oh, absolutely.
Okay. Thank you very much, Bruce.